to episode 4 of the Paper Pod. My name's Maisha and I work as a research scientist in London.
And hi, I'm Saneem and I am on the academics team at Maa, a maternal health charity and a doctor in London.
Yeah, so it's been a while since the last episode, so shall we catch up on what's been happening in between?
Yes. So we went to Bangladesh in the summer.
Yeah, on the Journey Maa trip.
Yeah.
2024.
Which is our annual flagship trip. And it was an incredible experience.
Yeah.
Despite the circumstances.
Exactly.
And really great to see the work on the ground and meet the Bangladesh team.
Yeah, exactly.
That was so fun. And I'm still in touch with some of the team, which has been
you too.
Great.
It was really lovely to see the other side of it, especially as the academics team. Doing all the groundwork behind it. It was super rewarding.
Yeah,
it's a rewarding experience. Yeah.
And coming back, I've actually really enjoyed. So I'm taking a break from training and working full time with Maa and Gravida within global health.
Yeah.
And it's busier than I imagined it to be. Really? I think you can't, or maybe it's partly me. I can fill up, or we've filled up our calendars with lots of things. We've already completed 2 project proposals and looking to grow, which has been really, really fun. And looking forward to spending the year completely immersed in global health.
Definitely. And what are the 2 protocol papers that we've got in right now? So one is on a mental health project, maternal mental health, which is super exciting.
Yes.
As you might remember, that's what I'm interested in.
Yes.
And then we've also got, what's our second protocol?
So the second protocol is to do with the app that we're developing.
Of course, for Gravida.
Yes.
So
and something that's been in the works for a long time. Yeah. So it's nice to have it on paper and now running.
Yeah. Amazing. Okay, so shall we introduce the paper for today's episode?
Yeah.
So it's called Achieving Sustainable Health Equity. And it's a paper submitted by Arachu Castro, Michael Marmot, Juan Garay, and Armando de Negri and Paulo Bos on behalf of the Sustainable Health Equity Movement, which is a group that these authors and a couple of others have come together to form.
Yeah. And we briefly went over the Sustainable Health Equity Movement, which looks like a really, really great initiative.
Yeah, for sure.
I think part of what we were discussing after reading the paper was how optimistic this is.
For sure. I think it's amazing and necessary to be this optimistic in this field, but it can seem a bit like, how realistic is it going to be and how long will it take to reach these goals, right?
Yeah.
But yeah, for sure.
But how do you think you balance that optimism with realism? So, okay, we'd like to achieve equity for all around the world, health equity in particular, and how do you then break that down into sizable chunks and timelines and kind of goals that you can measure?
Yeah, I think that's like the $1 million question, right? Because I think this commentary summarizes their goals pretty well in terms of how to go about having a timeline and chunking out the work that they need to do to get there. But it was really dependent on so many moving parts, especially because this is an international thing. Not only are you going to have to take into account the realisticness of the plan itself and the immediate team, like within the sustainable health equity movement, but also international governments, policymakers, NGOs and stuff as well. So I feel like it's something that needs to have a very long-term goal and needs to be consistently worked towards for a good amount of time. What do you think?
I agree. I think the only thing I'm kind of weighing up is that with the UN and the WHO and the SDGs, of the Sustainable Developmental Goals, where we have timelines on a set number of things until 2030.
Yeah.
Is that not already towards achieving health equity?
That's true. That was the aim, right? That was definitely the aim. First, we had the Millennial Development Goals and then the Sustainable Development Goals. So they were aiming to have health equity or equality by a certain year. But I feel like we're really reaching 2030 now. At 6 years, almost 5 years out, and there's still a lot that hasn't improved. There has been a lot that that has been successful. For example, like especially in the world of communicable diseases like malaria eradication across parts of Africa where it was very prominent, and even a vaccine for it now, stuff like that. And then obviously we had to deal with COVID in the middle, which no one expected. So I guess taking those as wins, but also realizing that there will be setbacks. It may be that we have to either rethink a new deadline, or realign what our priorities are in terms of health equity.
Yeah, I think that's a more realistic take on it. That I think there are always going to be things we could improve on beyond 2030.
Yeah.
And it's not that we, it's understandable that we likely won't hit the targets and they're aspirational, which is fine, but moving towards that as a goal is healthy.
For sure.
And we should try and push ourselves beyond how we expect things to look for the better. And yeah, if this is how we move forward for the next 10, 20, 30, 40, 50 year plan, and realigning, I think that makes sense, because I think this is the first time where we've now seen life expectancy go in the opposite direction and decrease. So we need to identify why that is, and really hone in on that.
I think there needs to be a reassessment of all of these things that we've been using as like our framework, our guidelines so far, like the SDGs and stuff. Not that they aren't necessary, but just to see how things have changed, like for example, life expectancy. And also I think however long the new plan will be, whether it's 30 years, 50 years, it's just having that momentum throughout, because I think it's easy to think, okay, it's 50 years away, we have time. But I'm sure we thought about this being so far, that like the SDG goals being far away, and now they're only 5 years away to reaching that target. Similarly for climate change, we're really we're struggling. We're not going to hit that target. The last COP meeting was not wasn't looking positive in terms of getting that 1.5 degree. So and that ties in nicely with what they mentioned in this paper as being important too. So I think time is of the essence, really.
Agreed.
Yeah.
However, how do you balance, okay, action is required here and reassessment is required here, and does that not bring you back? Is it going backwards in a way where
that's true,
you're pushing action to a different timeline? Like, how helpful is it to go in and kind of try and do something, and is something better than nothing, or is it that it's worth taking some time out to reassess and then be intentional with where you put the efforts and the funding? Because as I say, there is enough funding available. It's injecting it into the right places to ensure that there is equity.
That's true.
Yeah,
that's a good question, and I feel like then probably will be people on both sides, and it will be hard to come to a consensus about whether to like take action now or to step back and reassess. Personally, I think stepping back and reassessing is worthwhile, especially if funding is there. If you need to inject it into the right places, like you said, and maybe rushing into taking action, especially with existing guidances or frameworks or whatever procedures that haven't had the results that we needed, like taking climate change as an example, whatever we have done has not helped. So if we keep injecting money and taking action with the existing protocol, it may not improve the situation. So it may be worthwhile to step back,
Yeah. I think there's scope to be able to do both.
For sure, yeah.
So, for example, with maternal health, it may be that with the 3 leading causes, like for example, preeclampsia being one of them, we know how much we don't know, and there will always be an aspect that we don't know. And it's quite a preventable cause of death, where we already know how to go about it and manage preeclampsia. So we can continue moving ahead and treating the condition and injecting funding towards that, whereas maybe holding back on things where we don't have so much evidence and data, especially in low income settings and resource poor settings, where we just don't have enough data, and those being the places where we reassess and collect data before going in and rushing to spend on whatever we think. Yeah, definitely.
Having like a what would you call it? Parallel approach. I say, so stepping back and reassessing in certain areas while going full steam ahead in other areas, just to make sure that all areas are sort of being touched when we move forward, I think would be a good idea.
And how do you feel? I think there's an interesting balance happening within the academics team at Maa at the moment, where we have a protocol and a project running with preeclampsia.
Mhm.
However, the mental health project that we're also starting to run, which we've named MAP, and I think
Yes.
that's a nice
Brilliant.
catchphrase to
Yeah.
go with. It's something that's more on the sidelines. We don't really know too much about it, and it's about collecting data.
Mhm.
But have we reached the point where we can justify that, yes, we should go ahead and bring mental health onto the map in a resource poor setting?
Mm.
Now, are we missing something? Is there something in the middle we should be doing before that?
Mm. I think personally, I would say it's definitely something that should be brought on, you know.
Okay.
I think there are going to be obstacles, especially in resource poor settings and a culture really different environment, um, because, you know, mental health is dependent on so many things, especially cultural practices, social norms, and all of those things. So I think um, there'll definitely be a different set of obstacles that we would find in trying to enforce some sort of mental health guidance or even collect data in terms of mental health, like doing simple interviews maybe with women in these settings. For example, if we went to a Maa clinic in Bangladesh and started doing interviews about mental health with them, I think even formulating the questions in a way that they would understand um, might be difficult, just because it's not something that's socially acceptable or thought about, you know, often. Whereas if it was something, an initiative here, at least there's more conversation, you know, there's dialogue around mental health, and even ethnic diaspora here, you know, we're second gen, third gen, so it's different. But even for the immigrant population, um, there's a certain amount of adaptability that's taken place in order to fit in with social norms. So I suppose the conversation would be different. So I just think it's super important, but there will be very intricate challenges, if that makes sense.
Yeah.
Yeah.
I think it'll be interesting to see what comes up.
Yeah, for sure.
And also integrating the theory of change model to ensure that
Yeah.
we have iterations to adapt to things that do come up to ensure we're still moving in the right direction, even whilst we're doing the study.
Yeah, for sure.
And recently, I think from the Lancet, the Priya sent some a review through where there are statistics showing that even in the UK, women and ethnic minorities still struggle to access or don't know how to access mental health help with their mental health.
Yeah.
So although we may be aware of the dialogue around it in the open space, there are parts of the community who are still outside of that.
Yeah, exactly. I don't think it's reaching everywhere it needs to reach, and it's interesting because I think, you know, as I mentioned earlier, there's a certain level of adapting that takes place, but hanging on to some things like identity, even as a, you know, as a Bangladeshi myself, like, you know, a lot of the cultural norms or societal expectations and, you know, things that are acceptable are part of your identity, quote unquote. So I think it's easy to overlook the fact that, yes, okay, we've adapted to an environment where mental health is more open dialogue, but it still may not be on the radar or something that's acceptable or talked about openly within the community because of that concept of identity and social acceptability, you know. So I think, and then there are studies that have showed that actually, that the diaspora, ethnic minority diaspora, still struggle with the same cultural taboos that they would have faced, you know, if they were still living in a place like Bangladesh or, you know, yeah, which is interesting.
So do you think with this study taking place in Bangladesh, and if we are to compare that to the UK South Asian women population, that there would be similar findings, or do you think that things are different in the two?
I think there would definitely be a baseline of similarity, especially within maybe a certain age group. So maybe like the middle-aged or the parental generation and above. But I do think that maybe it will be easier to start the dialogue with people in South Asian women in the UK, potentially, especially if they've had family or generations that were born here and went through the schooling system here. As you know, like education does influence all of these things. So yeah, but I do think there would be a certain level of similarity. What do you think?
I'm actually really excited to see, and maybe a little apprehensive too,
Yeah, for sure.
because I feel that there are parts of Bangladesh, maybe more in the urban population, where I feel women have overcome quite a lot of taboos that we may still see in the UK, um, within the same age group or type of family setting, which is really great to see.
Yeah, definitely. Yeah.
But I wonder in the more rural areas where people just don't have access to things like a doctor or a healthcare professional per se, do they have that same level of trust and ability to open up to essentially a stranger? Yes, we would go through people who are already within the community. So, for example, a traditional birth attendant maybe having these conversations with women.
Yeah.
But if women in these spaces are so reluctant to even speak to their family members, how do we expect them to open up to someone outside of the family?
This is the thing, right? And I feel like that's the case. That could be the case anywhere.
Yeah.
In rural areas, maybe in some urban areas, and here as well.
Yeah.
So there's definitely, I also have a level of apprehension when trying to do this, open up this conversation, especially as outsiders ourselves. But I think whatever data that we can collect will be extremely informative on the way to move forward with mental health.
True. Yeah. And just starting the conversation, as you were saying.
Exactly.
Yeah.
Yeah. So this paper really stressed the importance between achieving sustainable health equity being linked to not only social equity but also the climate crisis.
Yes.
Which I thought was a very interesting and astute, correlation to make. Yeah, what were your initial thoughts from reading the paper?
I think my first thought is that, of course, the climate crisis is a big topic.
Yeah.
Both within local and global spheres. Even in Bangladesh, there were talks around the climate change that the country is facing with floods. So before we arrived in Bangladesh, there was a lot of flooding. Where one of our health camps were cancelled due to flooding, and the first health camp we went to, we had to have smaller facilities put into place, and
to work around.
Work around the flooding that we could see around. And the reality that those of us living in places like London and the UK and the States, where we have access to such a great amount of facilities, but maybe not using them as efficiently as we can, is putting places like Bangladesh, like South Asia and Africa, into the realities of what the climate change then creates. Yeah. So they're dealing with the side effects of our actions here.
Yeah, and that was something that stuck out to me in this paper when they said that the largest contribution to climate change is from the people that are least affected by it.
Yeah.
Which is, it's an eye-opening, thing to hear. And yeah, I think there needs to be more awareness about how access is already skewed for those that need it the most.
Yeah.
And now that's being perpetuated by, natural disasters related to climate change and global warming. So, yeah.
And how the distribution of wealth also feeds into this, where most of the wealth is held within a small percentage of the population. And how that also impacts the use of facilities, creating changes like this.
Yeah, for sure.
And they mentioned that inequities are unsustainable, and the importance of having tax schemes or funding schemes to help distribute wealth.
Yeah, to redistribute it equally or equitably.
Equitably, yeah. I wonder what you think about something like that.
I think in an ideal world that would be brilliant, right? Even in the UK, we have the taxation system where supposedly the more you earn, the more you're taxed, and it's meant to do this. It's meant to feed money in so that you don't have a really rich or a really poor population. But I think there are too many. Without getting too political, I feel like there's so many different loopholes in the system and the extremely rich, or the top 1% or 2%, are just staying in that realm, whereas the amount of poverty is increasing, even here. Um, and I think it was interesting that they mentioned, when it comes to healthcare access and like accessibility and affordability, that there are a lot of like monopolies in place, and they saw it during the COVID pandemic. And they also mentioned it being an issue in the first initial two decades of HIV. So in a way, I feel like even though we're progressing with healthcare, we're progressing with understanding finances and how we should be redistributing wealth, we're still, you know, we still haven't made progress because we're still repeating some of the same actions. Like, HIV was more of a was more prominent. Was it the 80s?
Yeah.
It was the 80s. So, and here we are, like, 30, 40 years on, and in this another pandemic, and we're still dealing with it in the same ways when it comes to equity. It can be difficult.
Agreed.
Yeah.
Agreed. And then we move on to the aspect of education.
Mm-hmm.
And I think we've already touched upon this, that some of our women's health programs and again in previous episodes of the podcast, how the level of schooling of a woman impacts their physical health,
Yeah.
can impact their mental health,
Yeah.
and the importance of sharing knowledge around to help uplift other people and ourselves.
Definitely. And again, it's, I like that they mentioned the importance of continuing education, but also highlighted that it creates space in life for self-fulfillment, creativity, and innovation, which I thought was really nicely put, because sometimes maybe we think in a black and white way when it comes to education, in terms of, okay, higher education, better job, better pay, but I also think education creates an open-minded look on the world, and gives you that space to come up with better ways to improve society as a whole and tackle such issues, rather than just thinking on an individual level of how to improve financially.
Yeah, I think that's a wonderful way of looking at it. The one thing that has been on my conscience since coming back from Bangladesh is, whilst we were there, we had the period poverty camp at the last village we visited.
Yeah.
And I asked maybe 4 or 5 girls what they'd like to do when they grow up.
Yeah.
And one said doctor, one said teacher, one said lawyer. Yeah, what you would expect, I guess, to hear from within a South Asian population. But I think the reality struck me quickly that what are the chances of these kids going into higher education to achieve such a goal?
Yeah, that's true.
And how there are stages to this. I do agree that despite maybe achieving that within the generation currently going through the schooling system in a very rural village, creating that, or creating the opportunity for an open mindset to form, is beneficial for the next generation regardless.
Yeah, sure.
I don't know how you feel about the reality of how these things go in cycles and need time to develop into maybe what we take for granted.
Yeah, definitely. I think that's a really good point that you make. The reality of all the obstacles in place for these young women to go into higher education or complete standard level of education, even, whether that's secondary school, or primary school. It's hard because, again, it is a bit of a cycle, because a lot of the families, maybe because of poverty, don't have the luxury of being able to invest the time into a child who could be working.
Yeah.
And I guess that's the case for men as well as women. But I think it's more complicated in these cultures and societies with women, because they are also valued for being mothers in the future and having children and settling down and starting a family. So yeah, it kind of becomes a balance between commodity versus long term outlook.
Yeah, but I wonder if, as they go into to mention around policy, whether working towards even more approaching governments and maybe suggesting something like children staying in school until, let's say, 16. 16 may be aspirational, even if they stay till 14, maybe still beneficial.
Yeah, yeah.
Is that, yeah, do we have the right to do something like that, or to propose
That's true.
something like this?
I feel like as Maa, just by ourselves, probably not, right? But with the help of policymakers and government officials, definitely, I think it's something that should be enforced. And I feel like it has been attempted before, if not in Bangladesh, in other South Asian countries for sure. But it's just how are you going to maintain it? And in Bangladesh, for example, how are you going to check that school that the children in these rural villages are going to a school? Do they even have access to a school? Is there a school nearby? How are they going to get there? And if no one's checking,
Yeah,
how do you know if it's going to change? Right? It's hard, and then you can't enforce punishment or legal action if for example, if you didn't send your kid to school, you'd get in trouble.
parents would, yeah.
But if it's not the same over there, it's really hard to do either or.
Which is why I think I value what Maa does so much. I think a small group of people helping a small group of people who need a hand is sometimes more effective than trying to go and solve a world problem in one go.
Yeah.
Where even if we were to stay in just Mali Bazaar and Sylhet for the next 50 years and really just focus on this village in particular and building up the whole primary, secondary, tertiary care for maternal health is maybe in a way more helpful than trying to change the entire world. And
I know for sure, yeah. I agree, and we're like grassroots, right?
yeah.
So and it's easier to start small and measure the success of it, measure the downfalls of it, learn from it, and then scale up, right?
Yeah.
And it's super valuable to show success and have a plan and a clear protocol and intervention laid out with results and an analysis of any drawbacks and disadvantages or learning points.
Yeah.
To look sort of lucrative to scale up and do things globally or even nationally. So yeah, for sure, I agree with you.
Yeah. I think, as in with the whole Gravida project and moving nationally and internationally, and Maa has done international projects too. I think focusing on one thing, it's doable. So if we were to focus on the 3 leading causes of maternal death in different places around the world, I think we've now, almost 10 years in, built up a framework that we can take into different settings.
Yeah.
But in terms of things like mental health and maternal health in general, with prenatal, antenatal, postnatal care, there's still so much to be done on the ground.
Yeah.
I'm in Absar.
Yeah.
Before really moving on anywhere else. And,
exactly.
And having that.
Yeah. And I think it definitely makes sense to focus in one place
Yeah.
and complete it to a level that's satisfactory before trying to expand. For sure.
But does that fall under achieving sustainable health equity if we're just doing it for one small village?
I mean, it depends on the level of health equity, right? There's equity within a household, and then within a community, and then within a town, etc., etc. So if you've got a system that you've implemented and it works in this small scale, you've achieved equity here.
Yeah.
It's much easier to take that and expand it than to attempt to apply equity from the outside on the big level, right? But I think there are arguments both ways, right?
Yeah.
Especially with this paper trying to take sort of an international framework approach.
Yeah. There's a need for that too, right? Like the top-down approach. Yeah. I do think there is a need for that and to be held accountable.
Yeah.
And then smaller entities to focus on their specialty.
Yeah.
For example, even in medicine, like you specialize to be a consultant in cardiology and resp and gastro, but you have the underlying concept of general medicine if you're a medical physician. Yeah, and maybe having this in place where you have an international institute holding us accountable to certain policies, and then having specialists who run their own part.
Yeah, for sure. And I think that's what they're leaning toward with this, what they're trying to suggest as a mitigation. So they'd want to have an independent, sustainable health equity commission with different members, I think, from the UN, and other places to come together to report on these issues. So I do think that is a good idea, and having that top-down approach, at least monitoring what's going on, is really beneficial to at least, and then have that connection and feedback with the bottom-up approach. People are doing it, there needs to be a conversation there, so you can take each other's advice on what is working, what isn't working, and work in unison.
I just wonder why this hasn't already been done.
That's a really good question, actually, and it was shocking for me to hear that the International Covenant on Economic, Social and Cultural Rights was the only international legally binding framework related to health equity, and even then, it's indirectly related to equity. So yeah, why hasn't it been done so far? I guess realizing that things are there's a whole upstream set of causes or domino effect happening when it comes to health equity and even health outcomes is becoming more prominent now, especially after all of the social determinants of health work that's taken place by Sir Mike Marmot and his team. So yeah.
And I guess the assumption that someone must be doing it. If the UN and the WHO exist, then they must be doing it.
You'd assume so, right? But it's good that there's been a spotlight on it now.
But do you think that having or creating a completely separate entity is the right way to go if institutes like the UN and the WHO already exist? Why not allow them to implement something like this themselves? Does it need to be completely separate?
Good question. I think it could work both ways. There's always this I think there's a similar debate in a lot of fields, like even in medicine. I think do you want a separate department, a separate area for a specific disease, or do you think a more multidisciplinary approach would be more holistic care of the patient? Like I remember when we were talking about geriatrics being a specialty, whereas you kind of need to have knowledge of endocrinology, and obviously you need a base knowledge of general medicine for a lot of these things, but there's a lot more multidisciplinary thinking required in a specialty like that. So rather than making it just one specialty, wouldn't it have been better to have an endocrinologist or a cardiologist and a gastroenterologist informed about geriatric medicine as an example? So I guess with the same argument, you could say if the UN and the WHO exist, they could just take social equity and health equity onto their radar as one of their priority topics or things that they're addressing. Or is it actually easier just to make a group like you just made geriatrics, and then people will have their sole focus on there with background knowledge? I guess it works both ways, right?
I guess we'll find out.
Yeah, I guess we will. Yeah.
Nice.
Great. I think that brings us to the end of this paper. It was a really interesting read, and it'd be cool to see how it moves ahead.
Yeah. If you have any feedback, we'd love to know.
Yeah, definitely.
Any thoughts on which way you think we should be going, whether there's space for, or whether it's beneficial to bring in a new group for this, or if it should sit within something like the UN. I think they do mention that they would report to the UN.
Yes, they do.
Yeah, we'd love to know.
Yeah, definitely. Thank you. And see you guys in the next episode.
Bye.